Good evening. Good evening, everyone. I'm Dr. Mike Cromer. I'm president of the Hillsborough County Medical Association. I want to welcome you tonight to our Hurricane Preparedness webinar. In case of you weren't aware, not only are we in the middle of a COVID-19 pandemic, but we're also right in the middle of this year's hurricane season that typically runs from June to mid to late November. And we're happy to have with us our presenter tonight is Ryan Pedigo. He's the director of the Public Health Preparedness Division at the Florida Department of Health here in Hillsborough County. And he's the lead person in the health and medical operations at our County Emergency Operations Center. In a minute, I'll be turning the slide presentation over to Ryan, but I want to let all of you who joined be aware that at any time, if you have a question, please feel free to press the chat icon button on your screen. I will be monitoring that and be able to pass any questions along to Mr. Pedigo at the appropriate time. If there's any questions left at the end, there will be some time for additional questions to be able to type into the chat. We feel like we have a good person, interesting person to present for us here. I was thinking that what we as physicians needed is some information that would be good not only to us and our families, but also information that would be useful to have for any patients that we have who come to us with questions or with special needs in the medical arena. Because Mr. Pedigo's division is responsible for planning and preparing for, responding to, and recovering from the effects of both man-made and natural disasters like hurricane. And he has to ensure that there's a viable and responsive public health and medical system in place after any disasters that may or may not occur. In fact, his team has responded to multiple hurricane activations in the past: the 2009 H1N1 pandemic, 5 different disease outbreaks within our state. He was ready and prepared for the Haiti Relief Program, Super Bowl 43, and the 2012 Republican National Convention. So we feel that Mr. Pedigo has a lot to offer us, and I want to, at this time, turn the screen over to him. And Ryan, go ahead and introduce yourself further if you'd like, or just go ahead and get right into the presentation.
Okay. Thank you, Dr. Cromer, and I would like to thank the association for allowing me the opportunity. One of the things in our business that we learned very early on is that awareness is key. It's both key to survival, it's key to recovery. And one thing we continuously fight with our patients, with our citizens, with our clients here in the health department or just in the community is apathy. It's never going to happen here. It'll never happen to us. And the only way we can do that is through education and getting as many advocates in our system, in our healthcare system, talking to them and trying to get them to understand we live in a very volatile environment here. With climate change, we are seeing greater intensity of storms. We're seeing a lot of civil unrest going on recently. Much more so than I can remember back as a professional career. Prior to that, when I grew up in the 60s, I remember my elder siblings partaking in different demonstrations for a different reason, but we are seeing violence in the streets, and we are seeing a lot of risk situations that are being managed, whether it's terrorism, whether it's a transportation incident. It really doesn't matter. Anything that happens is going to impact our system, and that's what we try to work with the medical system on, whether it's hospitals, home health, private practices, practice groups. We try to work with everybody to make sure we are prepared. You just never know. And if you look at this slide, we take a threat-based approach to planning and preparation. Everything we do is based on partners and community. The Department of Health cannot do it by themselves. It does take a community. These headlines you see up here and these photos you see up here on the upper left, these are real headlines. And this is what goes on constantly, whether it's the bombing in Boston, Ebola a few years ago. Thankfully, that was not a highly contagious disease like COVID is, but I'm definitely going to be updating this slide with my little COVID icon. But we have to look at things from a medical systems approach. We can't look at things, one hospital, one doctor. It has to be a systems approach, and we have to look at it integrated. And so what we do through a local coalition, where hospitals are members, we have members of specialty groups, we have home health, we have nurse registries, we have long-term care facilities. We get together and we come up and look at different scenarios, and then we provide training. We identify the gaps. We bring in people from Texas, we bring in people from Minnesota to come down and provide training, and then we also exercise what our response is going to be in a given situation. Sometimes they're tabletop discussions. And for those of you who have ever worked in a hospital around here during the springtime, they're mass casualty exercise where we get live students pretending to be victims, whether it's from a mass shooting, an airplane accident, chemical exposures, infectious diseases. We go through and cycle through all these different scenarios. One thing I've always said about Tampa, not just the proximity to the Gulf, but from a community-based view, we are probably one of the more medically prepared communities in the country. We get a lot of queries from Boston, Dallas, Oklahoma City, looking for information on our approach. And we happily provide that. This coalition I'm speaking of is part of a national group that we share information, and we all learn from each other. But I will tell you, Tampa Bay area is one of the regional coalitions that gets the most questions. One of the reasons for that is this slide here. What this slide shows you is every major hurricane, that's a Category 3 hurricane or above, where their landfall was since 1950. If you look at the Tampa Bay area, Pinellas, Hillsborough, Manatee, there's nothing there. The last time we had a major storm was in 1921. That's almost 100 years ago. If you pay attention to weather geeks like I do, they're always putting out in the New York Times every year a big article about Tampa's the #1 to get hit this year with a catastrophic event. Hopefully that won't happen. No one really has a good scientific explanation for why we haven't had a major storm come through. We've had them come through from the south. We've had them cross the state from the East Coast into us, but not a direct hit of a major category storm. And Category 3 and above, you're starting to talk catastrophic damage, which if you get that, it's going to be years and years. And really that's what keeps me up at night, is that what if scenario. So we really focus a lot on hurricanes. They are the biggest threat to this area. When you have an RNC or a Super Bowl like we have coming up in February, we're already planning for that. But those are one-time events. A hurricane can hit you, as Dr. Cromer said, it's, starts in June and goes to November, and we're actually approaching that peak area where statistically we see more activity anytime. We were chatting just before the start, and he asked me about, do I worry more about the ones coming off the coast of Africa or the ones in the Caribbean? And the ones coming off the coast of Africa, they make more landfall along the East Coast. So I've got more time to prepare for them. The ones in the Caribbean, not so much. And I gave Hurricane Michael as the example, where in 3 days it went from projected to be simply a tropical depression to a Category 5. Every time you turned on the Weather Channel, there was a new prediction out with a new intensity level. So they can come on quick, and they can be totally devastating. So the question is, how do you respond to that and look at it from a system? And you really have to have a coordinated response. And this is what my division does. This is what Tampa Police, Hillsborough County Sheriff, law enforcement, hospitals, pretty much every agency here in this county gets involved in. And we start out locally because that disaster, all disasters are local. The first thing we're going to do is look regionally for assistance, whether it's assistance with sheltering. In COVID, for example, we were requesting from Orlando, because early on they were reporting very low numbers. We were requesting PPE from them until we could get it from the state, which was our next request. The state also was getting it from places like Alabama, who had low numbers, as well as having a federal request in. Everybody works together. When it comes to a hurricane, what's interesting about this, when it comes to a hurricane, is I will have, sitting in our emergency operations center, I will have a regional emergency management representative from the state. He is responsible for 9 counties in this area. I will have a state Department of Health, state transportation, state emergency management. We'll have representatives of the Florida National Guard. And then I'm also going to have representatives from FEMA. I'm going to have a representative from Health and Human Services and CDC, all here in this area. Because when something happens, if we have not predicted that, oh, we might need this, these are the folks who can get it for us and get it quickly. So we're all working together. As Dr. Cromer said, I work at the Emergency Operations Center under the Health and Medical Services branch. And what we do there is communication with the hospitals before, during, and after. We look at their census. We start monitoring urgent care centers. We start talking to private providers who may have issues. In hurricane, it's not so much that I get very involved with private practice, unless it's a large practice group. But in COVID, I did. There was quite a few practices that were calling me going, we don't have any gloves. Can you get us gloves? We can't continue our practice. N95 masks, could not get those. We were requesting, processing those requests, and delivering them. So it's a coordinated effort, and it starts here locally, and it goes all the way to the feds. Most people don't realize 90% of the N95s that were in the Tampa Bay area by the end of March came out of the federal stockpile. We weren't getting them from Granger. They had been bought out. So, and the same thing happens in a hurricane, is we will get whatever resource we need from the lowest possible level. That frees it up for someone else, because when you start looking at the state, hurricane's going to impact Tampa Bay, but it might impact Jacksonville when it exits. Irma impacted the entire state. So everyone was asking for stuff. What the state does is they have their representatives here. They're communicating with the state here's how bad it is here, here's how desperate the need is. And that's how the state prioritizes their response, because they're looking at the entire state, not just Tampa Bay. And sometimes that doesn't make our politicians very happy, because we are the most important people in the state of Florida, and they should get it right now. And sometimes it really doesn't work like that when you're talking about life-saving measures. So whether it's hospital evacuation or simple supplies, that's what the health and medical desk at the Emergency Operations Center does. And we're sitting there with people of every discipline. Parks and recreation. We're sitting there with debris management people. These pictures on the left are of the old Hillsborough County Operations Center. I actually don't have any of the new Operations Center, but it's much, much larger. But all of us are communicating. And to give you an example of why everyone is there, the school board, City of Tampa, Plant City reps, USF representatives, everyone is there at the table talking, because if I need resources and I can't get them, they may have them. Hurricane Irma, if you recall, 2 days before landfall, it was supposed to run up the spine of Pinellas, which would have been Hillsborough's worst case scenario. We had 2 very large nursing homes, 140-bed nursing homes, right by the bay in the flood zone. They both decided to evacuate. One of them waited until the last minute to decide to evacuate. We had actually Parks and Recreations folks come out with their trailers to move actual beds, med carts, oxygen, everything they needed, all of their everything out of their facility, and take them to a safe place where their staff set it up. They relocated 122 patients safely. But it takes everybody. It's not just a magic wand that occurs and people move. We don't know what we don't know until it happens. Then we know it, and then we have to figure out how to deal with it. So that's why all these representatives you see in there are there and present. Everyone from the United Way to the dog catcher, they're in this building during this response, because you never know. And there's an incident commander who will be basically overseeing everyone. He doesn't really give direction, but the functional representatives like us and the incident commander are delegated the authority through statute for certain decisions that need to be made. If, for example, we have to evacuate an actual hospital, well, there's certain laws and certain things that need to be adhered to, or at least waived. We process those waivers, get that approval, and if it's a non-emergent evacuation, we're 2 days out. That's handled a little bit different than a fire in the building where they're throwing patients over their shoulders and running out. So that's kind of what we do there and coordinate that. You know, for COVID, we're actually doing this virtually, and it's working out very well. But you know, every day, 3 times a day, all of these people that you see here, they're all on phone calls with us on a Teams meeting, and we're going through stuff every single day. So that's kind of how the system operates in the background, and it's things you don't normally ever see. If anyone would ever like to volunteer during a hurricane, I'll be happy to give you a position at the table and provide some relief. It gets quite busy there. And so the things we need you to do, though, as physicians, particularly those in practice, and I bring this slide up because a lot of people, if they're with a hospital, hospitals have these gigantic plans. They have binders and binders of plans. And they have a plan for just about everything, whether it's, you know, linen exchange when their linen provider goes down, to oxygen, to evacuation, to, you know, Tampa General is going to evacuate up, and, all the logistics involved with that. But as a private practice, here's what I see and have seen on multiple occasions in responding to disasters. This picture down here at the bottom, that is a picture of a jitney jungle in D'Iberville, Mississippi. D'Iberville is that little bitty community right across the bay from Biloxi. That picture was taken exactly 1 year after Katrina went through. The physician that had his office in D'Iberville was basically, the building just was the foundation only. He got hit with the tide surge and it just took his building away. He set up shop there and he stayed there, operating out of there. By this time, he actually had a facility, but the population in D'Iberville, as stubborn as they were, they, kind of wanted that little local thing. So instead of driving across the bridge, which had been opened up, and going down to Biloxi, he kept a small staff here, and he was actually seeing patients, and it was approved by the Mississippi Department of Health for him to do that. But one of the things we noticed was, when he didn't have his clinic, that meant that every other provider out there was shut down. All the hospitals received fairly significant damage, but in those 6 lower counties of Mississippi, there was no medical system. They had not prepared for that. And so what we had to do was kind of get people in there to set up some type of emergent system and referral process to get them seen if it was an acute illness or an injury, and then have them referred. And we were flying people up to Harrisburg and Jackson daily who needed hospitalization because there was nothing there. But when you are starting to look at your practice, is your staff going to come back? Are they safe? Do they know when to come back? Protecting your property. If you get a Katrina type event with tide surge, there's not a lot you're going to be able to do for it. But Irma, we had places here in Hillsborough County and physicians' offices and labs that were without power for over 10 days, which is a very long time. So protecting your property, preparing your office is critical. And one of the things that Irma also highlighted to us, as well as Katrina, as well as Michael, was we still have people out there who do not have electronic health records. They're still using paper. They're still using paper prescription pads. And in some cases, I realize that's necessary, but I give you an example. In Hurricane Michael, when I went up there and everything was down, there was no pharmacy. There was no private offices. The EDs were the only thing operating at the hospital starting on day 3. So there was a gap. What we saw was trying to get someone a prescription refill. You couldn't do it. And we finally had a Rite Aid pharmacy open up. I'll never forget it because I went up there with the health officer talking to him, and he said, no, I don't have a computer. The only thing I need is a paper prescription. And that community is very small. Everybody knows everyone else. And we started asking around, and no one had a prescription pad. And we ended up actually going to there's an Army base called Fort Rucker just up in Alabama. And we called the hospital up there, and they said, well, we'll send you a doc with a prescription pad. And he came down. He actually stayed for 10 days helping us out. And but he was the only one until they could get stuff going again. Electronic health records, critical, because they're cloud-based and you can access them from any computer anywhere. But it also allows individuals, they could actually put their medical record on a flash drive. If they were evacuating from a continuity of care standpoint, Hurricane Michael, it was 30 days before people could come back in some cases. And if they had chronic issues, what were they doing during that 30-day period up in Georgia or Alabama or wherever they happened to go? So protecting your offices is critical. And right along with that is making sure your patients are ready, particularly those who have chronic illnesses, individuals who require different types of treatment and support. We have individuals who require electricity. For whatever reason, those people won't evacuate. I always tell people your best plan you can possibly come up with is to go to Montana from June through November, because you will not get hit by a hurricane up there. Leave in November because you don't want to be stuck for 6 months at a snowstorm and come back down. So snowbirds actually have a good mentality when it comes to disasters. But we need to educate our clients. We need to educate our patients. Equipment was an issue. Getting oxygen after Hurricane Michael, there was no DME companies running around. We were having stuff brought in from Marianna, Florida, from southern Alabama, southern Georgia. People were bringing stuff in. And we were setting up areas where people could come refill their little bitty oxygen tanks, because their concentrators certainly weren't working until we could get a system set up to where we had larger tanks brought in and could actually have fire rescue bring those tanks to those people's houses. But if you had someone on 4 or 5 liters of oxygen and it wasn't PRN, it was, we're going to evacuate you to a shelter where we have oxygen, we have power. And that's one of the things we do here is we look at this kind of stuff and we plan for the people who don't want to leave or can't leave. And, particularly this year in COVID, people got to be crazy to want to come to one of my shelters. The chance of that disease being in that facility is high, and the chance that it will transmit is high, and the chance that one of my 65-year-old with COPD is going to catch it is high. It's kind of like, and I've told a few of them, it's kind of like playing Russian roulette. You want to leave the area, get out of the path of the storm. That's the only safe way to go. So what we do have, though, is an education. And if you can educate your clients, as I mentioned, dialysis, when they take on a new patient, they do a 1-page quick disaster plan. They want to know if they're going to evacuate. They want to be able to refer them to someone. If they need help, they go through a little bitty checklist. How you can help is you can be familiar with the services that we offer in the county for these individuals. You can provide them with educational materials. You can provide them with just general information, communicate with them. Send them a reminder at the beginning of every hurricane season. Do you have a plan? Now's the time to start thinking about it before the storm gets here. It's very simple. It's not hard to do. We have several things that we offer here. One in particular is the Lean on Me project, which this is something that in the Department of Health we've created, and we will come out and work with your staff on how they can quickly educate their patients, provide them the tools to give to the patients. We're not asking them to sit down and spend 2 or 3 hours with the patient, but just a quick thing, and provide them with this information that they need to create a plan. One of the other things we do is the special needs shelters. We find a tremendous number of people in this county have no idea these exist until a storm hits. Because while I might have 4,000 people in my registry now, I probably got 180,000 people who would qualify in Hillsborough County. I can't shelter that many, but I do need to know where they are. And all that is a very safe structure, and it's got power and air conditioning. and they can plug in their concentrator, they can use their CPAP, they can use their BPAP, but we don't want them to do that during, COVID, because that's going to help spread. We've had a lot of discussion about that type of thing and what we're going to do to mitigate that, which we've got some pretty good ideas on how we're going to deal with that. But we also come out and we'll talk to people. You'd be amazed at the number of patients you have that might be part of a senior association, a home association, and people don't know. We will come out and educate people on general preparedness topics, special needs shelters, bioterrorism, chemical response, anything someone wants. If it's in our wheelhouse, we will happily come out to help with that. So our Lean on Me project, basically what we would do is come out, spend about 30 minutes with your staff. We would provide you with this simple planning template. Most planning templates you get from floridadisaster.org or the federal government, they're 23, 24 pages long, takes about 3 weeks to fill it out. I don't have one. I can't do that. It's far too complicated, and I don't need 90% of the stuff that's in there. So what we've done here is tailor it down, shorten it up to about 3 pages. We tell them, here's what you need in your quick kit. For your disaster plan, I live in an evacuation zone, a mobile home or whatever. I need to go to place X. Here's the medications I need to bring, and here's some important numbers. And that's the gist of it. It's simple and it doesn't scare people off. We provide you with a cache of boxes that you could hand to the people because we want them to bring their important papers. We want them to bring their marriage certificates, birth certificates, passports, whatever. Medications they can throw in this. It's a waterproof box. And we'll even give them a NOAA weather radio as well. So we can provide that to you. You could provide that to them. If they have questions, we would ask that you refer them to us, and we can sit down and work with them. If we have to get College of Public Health students to go out and do a one-on-one visit, we can do that. COVID, it's a little bit different to do that one-on-one, but we'll work something out. Our special needs shelter program is the envy of the United States, and this picture tells you that this is what my clients expect when they come to my shelters. They are expecting the beautiful bed and breakfast rooms, and when we talk to them and we educate them, and then they find out this is what they're going to actually be walking into. This was a picture taken of the floor of the Youngling Center, formerly known as the Sun Dome, during Hurricane Irma. This is the reality of hurricanes. It's not a pleasant place to be. If you look around at some of these individuals here, we're going to have the lights on the entire time. So it's going to be light, it's going to be loud, noisy, no privacy. Now, COVID, this would never happen in COVID, I'm praying, because COVID, I'm going to be maintaining distance between these people. There were 797 people on the floor in this photo. During COVID, we're going to limit that to 212. And what that does is maintain distance in between each cot. County has already purchased barriers, which are going to be, if you think of a cubicle office type of space, these are vinyl barriers that we can quickly set up to give separation. If someone needs a nebulizer treatment, for example, we have an isolation tent. It's basically a 10 by 10 tent with a roof on it that we will put them in when they need their treatments to help reduce that spread, because aerosolizing COVID, it's 6 feet isn't going to do it. You're going to be sharing those people's air. So we're going to separate them out. We have isolation areas in the shelters for anyone who turns symptomatic. It's going to look quite a bit different. But when you go from 797 down to 220 or so, it's going to be different. So we spend a lot of time registering people, educating them on this. We staff it. There is no skilled nursing here. We do assistance, and the people who are eligible are people with that are stable medical. They don't belong in a hospital. We do not take discharges from hospitals to the shelter. That is a no-no. If they're in the hospital, that's probably where they should ride out the storm. We do have a lot of people who apply to us who exceed our scope of care, so we actually work with hospitals to get them placed in there prior to the storm. But someone who needs dressing changes, whatever, people who need assistance with medication, people who need electricity, people with cognitive or mental limitations that require assistance. This one gets a little bit touchy because there's so many varying degrees. Say, for example, Alzheimer's, Parkinson's, and Parkinson's manifests in many different ways. If we have someone who has hallucinations, for example, and the potential for violence, we will not screen them into the shelter. We will work to place them elsewhere. So there's a lot that goes into this, and my staff do a great job in maintaining that registry and getting the right people in here and keeping them safe. So that is another service, but not a lot of people are aware of it. They know about shelters and they go to their general gym, and you can imagine what's going to happen to an 85-year-old man and woman who are sleeping on a concrete floor. It's probably not going to turn out well. So we provide them a medical cot, food, and oxygen, electricity, air conditioning. We keep that temperature 82 degrees or below because we do not want a repeat of what happened in Miami. So the way to get a hold of us, and I believe Elka is going to be copying this and sending this information out. If you have any kind of questions about any of the things we've covered here, the registration for the special needs, the Lean On Me project, or you or any kind of group you know of wants a presentation on preparedness, topic specific, don't hesitate. Please give us a call. And Dr. Cromer, if there were any questions.
Yeah. So any attendees, if you'd like to type in some questions through the chat box, I'll keep my eye on it, and be sure to ask Ryan any questions pertain to the presentation. But Ryan, in the meantime, I have a couple questions.
Yes, sir.
You mentioned, a song came to my mind. I want to be in the room where it happened. When I see that picture of everybody who can do anything during a disaster, I bet you it is quite a place to see. Did you say that visitors are welcome, or you would allow us selected people to come and see how that operates sometime?
Actually, we have a medical reserve corps where we recruit physicians, nurses, and whatnot. We have several physicians that work with us up at that center. During COVID, of course, it's not active, but we're doing it virtually. But to place patients, evaluate their needs, and that type of stuff, we have a group of docs under Dr. Melissa Lemming. She'll bring in some residents. She'll bring in some of her buddies from Tampa General who will work with us and screen all of our patients and go through it. And we do that generally at the Emergency Operations Center. And then just if they want to stay and assist, we are happy to have them there and work it, because we go for, Hurricane Irma, it was 30 days we were activated, which don't expect people to do that the whole time, but to come in, learn a shift. Again, we do exercises every year. where we're, balancing patients, decompressing hospitals for mass casualties, that type of thing. Throwing things at hospitals. One of my pleasures in life is to call up the charge nurse at the ED and say, you just lost power and your generator blew up. What are you going to do? We have a lot of roles like that, but we do get very, very involved working closely with the medical community. So a physician, nurses are very valuable in that environment, particularly in dealing with the hospitals.
That leads up to my next question. You mentioned the Tampa Bay area is sort of has a reputation of being prepared and good experience in this area. You with over 40 years experience, I'm certainly is part of leading that team. But tell us a little bit about how coordinated and ready and prepared are our local hospitals, and what role do they play? Let's say hurricane setting.
Okay, well, hurricanes, it's interesting because, we look at every facility based on its capability. You look at Tampa General, and I don't know who's on the line now, so if I insult Tampa General, I apologize. I'm going to build a hospital on an island in a hurricane-prone area. Realize it's been there a long time, but Tampa General's patient level, you can't evacuate them, at the drop of a hat. To evacuate Tampa General, and we worked with DOD, and we worked with the National Guard, and we worked with Tampa General several years ago and did some modeling. It would take about 3 days to evacuate Tampa General, because not only are you worried about moving the patients out, you also have to have a receiving facility capable of providing definitive care for them. You can't take some of those ICU patients they have, the burn units patients that they have, and burn beds are a premium. We could be sending people up to Georgia. That takes time to coordinate, arrange transportation. The documentation that goes along with that is just amazing. But if it's an emergent evacuation, yeah, we can get you out within 24 hours. It's not going to be pretty. People will die if we were to do that. Mm-hmm. So Tampa General's plan is to evacuate up. They're going to get off those bottom 2 floors. Memorial is in a level 3 or flood zone C. Town and country, or not town and country, Tampa Community, which now has just the ED and has switched to a behavioral health facility, that's also a flood zone C. So they could evacuate. And then we always forget about our 2 small kindred facilities, which one has to evacuate at a Category 1 storm. With a 4-foot tide surge, they will evacuate. So they're going to go to the sister facility. And then we look at what's left, and you've got St. Joe's, Maine, level 2. You've got Brandon, you've got Advent as far as the larger facilities go, and then the smaller ones. And, the idea is to know what their capabilities are, how much they can take, what we can place on them. We know it's going to be a strain. We know they're going to be in surge immediately, because also you're going to have people from the community just showing up wanting to be sheltered there because they did not evacuate. So working with them, we have a bi-monthly meeting with the emergency managers at each of these facilities. We go through their plans and we exercise constantly for this. But 6 times a year we're together. The hospitals are also tied to the Southwest International Emergency Management Conference group, where they tie all hospitals together to have these types of discussions. We're also part of the Tampa Bay Health and Medical Preparedness Coalition, which covers 9 counties from Citrus all the way down into Manatee. And we try to look at things from a system of care standpoint because, you know, Citrus, they're probably going to go up to Gainesville. Sumter's going to go to Gainesville or over to Orlando for their higher complex patients, but they're still part of this region, and so we include them in there. And anytime we do any kind of planning for an event like a Super Bowl, we bring the hospitals in because what hospitals deal with is the consequences of an event. That's what they deal with, the consequences of an event. If you don't have an incident, then they're just doing their normal thing. You have a mass shooting, they're very busy.
Yeah. As you were speaking about us as physicians asking our patients if they're ready and having them have extra supplies of medication, equipment ready to go, oxygen tanks filled, something that came across my mind was dialysis patients. And I thought my preparedness for them was to I was going to ask you, do we want them to arrange for other dialysis centers to go to in the center of the state or in other states? Or I saw that your shelters actually take dialysis patients.
Yes, we actually encourage dialysis patients to come to the shelters. We provide generator to a specific dialysis center, and we
Okay.
have them up and running within 12 hours after the storm passes. The dialysis community, Fresenius, you know, DeVito, we work with all them. They're part of this coalition. They will contact every single patient they have and get them in, and they will stage it down to a 2-hour session, enough to kind of tide them. And then if they come to my shelter, one of the things we're asking them, okay, is when was your last time? And then we'll figure out from there, okay, when are you due again? And then we will transport them to our center. We also use the VA as a backup because we want all of our dialysis people to go to the Youngling Center if possible, if that shelter's open. If not, then we'll look at Irwin Tech. But we will actually transport them there to be dialyzed and then bring them back to the shelter. We don't have the capability to have portable units brought into the shelter for just from an infection control standpoint. It wouldn't be well.
Okay. Thank you, Ryan. Well, I don't see any other questions at this time, but what I have taken away from this webinar is that being aware of what we as physicians can do and need to do is the key part of it. And getting educated through seminars like this and through training that can be had in our office from some of your staff would be important. And then also doing what we can to prepare and then discussing with our patients what they need to do to prepare.
Yeah.
So Ryan, thank you for your presentation this evening. What you do is an amazing job just to see the breadth and the depth of what happens behind the scenes is exciting. And it's also good to know that we're in good hands with you and your whole team. Attendees, thank you for joining us tonight, and I hope this has been useful as we enter into the tail end of the hurricane season. Bless you and have a good night.
Thank you, sir.
Okay.